Hi everybody, welcome to another episode of Ask Dr. David. A lot has happened in the world of COVID since I last posted about this a few weeks ago, and so I wanted to share my view of what I'm seeing, and hopefully this will help you out too. So one of the first questions being asked is the pandemic over? Now, the definition of a pandemic is a worldwide infection, a worldwide disease. And while certainly we have seen numbers go way down, it certainly still is all over the world right now. So by the pure definition of it, certainly it does appear as if we are still in a pandemic by that definition. Now, the question is also, are we moving into an endemic, which basically means a more seasonal type of pattern, which of course we are expecting that to be happening, where people would be moving into more likely to be catching it in the wintertime. But again, we're not there yet, and we have no idea what's going to happen in terms of further variants. But it does appear, for all intent and purposes, that from a societal perspective, that the pandemic is over. We are seeing that governments have now significantly relaxed the mask policies, both on the local, state, as well as federal level. And we are seeing, even that's true in terms of some of the vaccine mandates that were being imposed by the government. Some of them obviously never went through because of the court hearings, but even still, we're seeing a lot of states are also laxing their vaccine. Like, for instance, up in the Northeast in New York, where people were having to show proof of vaccination in order to go into restaurants, that seems to be laxing as well. So we are certainly moving into a more open and free society. Now, we are seeing the number of cases going way down. We're seeing hospitalizations going way down. We're seeing deaths are still up pretty high, although certainly on the way down. But I do also recall that we are still not even close to the numbers where we were at our lowest, which was in the spring and then late fall of 2021. So in terms of, are we out of the woods yet? In terms of overrunning our hospital systems, our doctors' systems, from that perspective, we are probably doing pretty darn good. But in terms of, does that mean that nobody's going to get the infection anymore? Of course, that's probably not what's going to happen here. But still, all great news around in terms of what we're seeing. Now, question number 2. How good is natural immunity? Now, we have seen, in other countries, have significantly understood that natural immunity, catching the wild disease, does contribute to both a person's own immunity as well as to herd immunity, despite the fact that in America, where there's been almost no recognition of natural immunity as being a very important part of what gets us out of this. But we're even starting to see that come around now due to Omicron. So obviously that's very good. But the research is also showing that people who have had natural COVID do seem to have protection that's better than people who have been double vaxxed, and on par, or maybe in some studies, a little better than people who have been triple vaxxed. So, the numbers are the numbers. Obviously, the government does not want us to be thinking in those terms because there is still, of course, the strong push to people to get vaccinated, but the numbers don't lie. And that is what we're seeing, the numbers out of South Africa, the numbers out of Africa, South Africa and Israel, the numbers coming out of England, Denmark, everywhere that's tracking this better than we are here in America, does seem to be doing that in that direction. So that's good that people, now that there has been so much Omicron around, that so many people got exposed. In fact, in England, where they do not give vaccines to young children, 81% of children under the age of 5 actually have antibodies to COVID. So that would tell us that natural immunity certainly has spread. Herd immunity has spread to the point where 4/5 of their population, of their children, actually have evidence of immunity based upon antibody levels when they check. Now, one other thing that we're seeing is that the vaccine immunity does appear to be wearing off sooner than people who have natural immunity. And the recent studies are now showing that there could be natural immunity lasting for up to a year in terms of antibody levels and in terms of reduced incidence of catching the disease again from people who have wild disease. Now, interestingly, what they're also showing, and this is something that you may have heard about, this is SARS-CoV-2, but there was, of course, a SARS-CoV-1. That was back in 2002 to 2004. People who had those infections 17 years later are still showing antibodies present in their body. So does natural immunity provide long-term immunity? Well, of course, every virus is different. We don't know that for sure, but certainly a very close cousin of SARS-CoV-2 has shown that immunity is very long-lasting when actually people are checking these things. Now, there is also the question of hybrid immunity, and you may have heard about people who have been multiple exposed to whether it's the vaccine as well as with the disease itself, and people seem to be having even more broad protection. Now, that of course makes sense because it does seem as if when a person's been exposed to the spike protein multiple times, that they're going to have more immunity. Similar to, there's a reason why the tetanus booster was given at 2 months, 4 months, 6 months to build up that immunity. Other vaccines as well, but also there's a reason why people who get exposed to natural viruses don't seem to get sick. As a pediatrician who for the last 25 years, I'm sure I've been exposed to different types of coronaviruses throughout every single cold and flu season. Rhinoviruses, adenoviruses, all of these, and there's a reason why I almost never have gotten sick over the past 20 years, is because I am constantly being exposed to sick kids and evaluating them, and my antibodies are sticking around, and I'm probably boosting myself every time I get exposed to somebody as well. Kind of coming back to our question was, is Omicron a booster? Where it clearly is. Okay, now, there hasn't been much confusion, but also I haven't seen that much discussed about the new CDC guidelines relative to masks. Now, I realize that in certain places, especially here in Florida, if you look around, if you're in stores, if you're in restaurants, that mask policy pretty much has gone by the wayside. And that's kind of the way we are. Of course, we never went to some of the most stringent precautions, like you have to wear a mask outdoors when you're in the woods by yourself, like was happening in California at some point. But certainly we saw a much more laxing of our rules much quicker. And so people, of course, here in Florida are more comfortable being able to assess when they're in a more high-risk situation versus a low-risk situation. Of course, we talked about all of that, poorly ventilated places, crowds, etc. But of course, if the number of cases overall are lower, then the chances of catching COVID overall are lower as well. But these new guidelines that were put forth by the CDC breaks things down into 3 categories: high, medium, and low risk counties. So they're looking by the county. And the first thing that they're looking at is how many cases of COVID showing positive for any reason, whether it's asymptomatic or not, if there were greater than 200 cases per 100,000 people in a 7-day period, that automatically put that county into the high risk category. As of right now, Hillsborough and Pinellas County here in sunny Tampa Bay, Florida, are still in the high-risk categories. Now, medium risk, and of course, the recommendation of high risk, according to the CDC, is that everybody should be masking up when they are indoors. Okay. Now, medium risk is when the cases are under 200 per 100,000 per week, but they also now are taking into account how many cases are in the hospital per 100,000, as well as what percentage of overall beds that can be staffed by nursing and by doctors are filled relative to COVID. And there seems 15%, it seems to be the number there, that if the number is above that, then that puts people into the medium or high, depending on the other factors. But what the basic recommendations now are that if a county is in a medium risk status, that means that only people who are at high risk, the CDC is now recommending that they be masked, or of course, if they're around somebody, they live with somebody or have a significant exposure to somebody who is at high risk. And we've, of course, talked about what all those are. Now, many counties, lots of places in the Northeast, hopefully there are places down in South Florida, hopefully here in Central Florida soon, that are now in the green. That's the low risk. And the recommendation there is that nobody has to wear masks indoors. Now, they say it's certainly people can choose to do so if they want. And of course, people who are high risk probably will continue to do that from some point. But the CDC is now saying that if you're in a low risk community, low risk county, that the need for to be wearing masks indoors under most circumstances are not required. And of course, that is a huge difference compared compared to the recommendations that have been put forth and that we've been dealing with for the past 2 years. So, it's good to see that the CDC is at least looking at the science. For so long, we've been saying, look at the science, look at the numbers, look at the science. And it seems as if that's not what was happening here. And you go way back to how things were in terms of what to do with boosters, what to do for kids' vaccines, where it didn't seem as if the numbers were really being looked at as much, and it was more social policy. But now we're actually saying the numbers and the recommendations do seem to be matching up, which of course is really good. Now, of course, want to say that if a person is going to choose to wear a mask, the N95, the KN95 certainly are still superior to the cloth masks, which are basically just face dressing, as you've heard me say, or even the surgical hospital type masks, which are definitely more protective than cloth masks, but certainly not of the level of those other masks. So again, giving you the information so that you can decide what is best for you, your health, your choice, of course. Now, overall, the question is, how worried does an individual need to be with COVID at this point? And it really depends on two things. Number one, do you have immunity already? Natural immunity, vaccinated immunity. We've talked time and time again that this is all part of herd immunity, community immunity. I like that term, community immunity. It just sounds like I should write a song about that. But it seems like it's a really, it's a nice kind of way of looking at it. But of course, if a person doesn't know whether they have immunity, whether it's been a while since they've had a vaccine, or whether it's been a while since they've had the disease, or they may have been exposed to the disease but didn't test, or they just want to know because there's been so much asymptomatic, people can still do the antibody levels. And to recall, the SARS-CoV-2 semi-quantitative spike protein antibody, that would be a positive if people have immunity, whether it's from the natural virus or from the vaccine, but the nucleocapsid antibody is only going to be present in people who have had the virus itself. So that's one of the ways of knowing if a person did have asymptomatic, or maybe they had mild symptoms, maybe it was a cold, maybe it's not. That's still the way of knowing. It's still a great test to give people that level of information if they want to know. And of course, what level of pre-existing conditions do people have? As many people know, my mom is going through chemotherapy right now. Last week, her white blood cell counts dropped to under 1, so she's certainly in a high-risk situation. We'll be checking those numbers again coming up in 2 days from now, and the medicine that they gave her to boost it will hopefully go up. So again, things change with an individual, and being in touch with your doctor, knowing what those high-risk situations are, that, of course, is still important. Okay, now, the last question is, what about this stealth Omicron? Now, this is a made-up name, okay? It's Omicron still. Now, you may have heard people talk about BA1 and BA2. So BA1 is the first form of Omicron that we had seen that came out of, first identified in South Africa, spread end of November into December, January. Now, BA2 is considered a subvariant. It's still considered Omicron, but it's now what is becoming prevalent. I think like 30% of America now is there. It's probably going to keep getting more prominent simply because it is more contagious than BA1. But from all research that's out so far, it's not more dangerous. It's just more contagious. Now, another thing is that there have been rare cases of people who have had BA1 who have caught BA2. Now, they've been mild cases, nothing serious, but in terms of the question, is it possible to still get an infection with COVID after having Omicron? The answer is in rare cases, yes. And of course, and God willing, there won't be another variant of concern that's going to come about. Hopefully, Omicron is what ends this pandemic for reals and puts us into the endemic phase. But still, that we don't know, and obviously, we can certainly predict all we want, but time is going to play itself out. But of course, the other nice thing is that BA2 is providing that same level of immunity that BA1 does. And of course, we've talked before about how BA1, though back then when we were just calling it Omicron, was actually providing very nice antibody protection against the Delta, Alpha, Beta previous strains as well, which is obviously really good, and probably the reason why Delta went away, and probably the reason why it won't come back. And God willing, again, the coverage that we're seeing because Omicron is so more broad, that is why we will probably, fingers crossed, why we won't see a huge variant come around again. So, of course, we'll have to see about that as well. So I hope that this has been informative for you. Please, again, if you haven't subscribed to our YouTube channel, please do. Please join us on our other social media. Our handles are down below. Also, as you may know, I have started a Patreon page where I'm going on deeper dives, presenting some exclusive information there, things that are both science related, things that are just deeper dives into the people who we interview, to get to know us and to know me a little better. I've thrown some extra music up there as well, so please join us, and all the information is noted down below. Have a great day.